We have AI embedded in many parts of our organization. After all, at the heart of weather, it is data, right? We are a data-driven company. For example, severe event, we process more than 600,000 requests a second. And every single day, on average, we produce forecasts for 2.2 billion global locations every 15 minutes. To create one single forecast, we analyze over 100 individual forecast models from government sources, private sources, and our own proprietary models. And so again, data is really at the heart of who we are. And we also know it's our responsibility to use this data responsibly. The data we have from other sources, from our own users, from our own applications, we use it responsibly in order to keep people safe all over the world and to help you make decisions every single day.
All right. Next, I'd like to introduce Sushma from EMD Digital.
Thank you, Jordan. I'm Sushma Sabarajan. I head the commercial team for EMD Digital. EMD is part of Merck KGaA Darmstadt, Germany, which is a large healthcare group. And in EMD Digital, our focus is on providing data solutions that are relevant for providers as well as consumers of healthcare data. So on the one hand, we work with large academic medical institutions to help them to integrate very diverse data types that are coming from both clinical research and patient care. We also work to provide a safe and trusted collaboration environment where these data can be provided to interested parties in the healthcare field, such as pharma companies and biotech companies. So our primary focus has been on oncology, but obviously with the pandemic, we've also had a lot of efforts ongoing in the area of COVID.
And next, I'd like to introduce Andy from AdvaMed.
Well, thank you, Jordan, and I appreciate the Chamber including me in this discussion and look forward to our conversation today. AdvaMed is the leading trade association for the medical technology industry with over 400 member companies and a global footprint. We're headquartered in DC with offices in China, additional operations in Japan, Brazil, and India, and collaborations with sister associations worldwide. As Chief Strategy Officer, my responsibilities include oversight of domestic and global policy, which encompass the AdvaMed Center for Digital Health. 4 core work areas drive most of the center's activity, including regulation, payment and healthcare delivery, cybersecurity, and data stewardship and privacy. We established our Center for Digital Health because the medical technology field is being transformed by digital technologies and data capabilities. And we could talk at length about that transformation, but I'll just summarize key elements that illustrate its broad scope and its dramatic impact. Data generating technologies are diversifying and improving data collection within and outside of traditional intensive healthcare settings through encounter-based technologies, wearables, ingestibles, and implantables. These technologies enable collection of novel, real-time, more frequent, and/or continuous information that yields new insights into health and disease states, enables remote or on-site monitoring and interventions, empowers consumers and patients, and enables expansion of care delivery outside of traditional healthcare settings. Communications platforms facilitate synchronous and asynchronous person-to-person healthcare encounters, including, for example, telehealth visits and remote surgeries. And then aggregation, analysis, and use of data, advance scientific understanding, inform healthcare decision-making, support research and development, facilitate product approvals and regulatory compliance, enable the administration and evaluation of value-based care, improve delivery and quality of care, including patient experience, and empower remote and/or automated interventions. And finally, data-driven technologies inform, augment, and/or supplant human decision-making, and then effect remote and/or automated interventions. So that's the healthcare perspective we bring to the larger discussions around value of data, privacy, and a national data strategy. And I really look forward to our conversations today.
And finally, Michael, maybe I'll start with you with our first question of the day, and I'll have you introduce yourself with that. So Dr. Turner of PERC teamed with CTech actually recently to release 3 different reports. And one of those reports is actually the first part of our National Data Strategy white paper. Dr. Turner, you authored this case study about how data is being used to address COVID-19. Can you give us a brief introduction about what you do and also a brief overview of your findings?
Sure, thanks, Jordan. Appreciate the opportunity to be here today. My organization is a 501c3 think tank based in Durham, North Carolina. We're approximately 20 years old. We're the only think tank on earth that focuses on the relationship between information and information solutions on the one hand and social and economic outcomes on the other. While the majority of our focus over the years has been on financial data and financial inclusion, we've undertaken unique quantitative projects in healthcare, public safety, and a range of other issue areas as well. The recent work that we were privileged to do with CTEC was really a follow-on to some earlier work we had done on data privacy, data security, and data for good. And in this context, it was driven in part by the initial social and public media reaction to the pandemic. The pandemic really has two fronts: the healthcare crisis on one side and the economy on the other. And the overwhelming majority of attention on both was focused on the problem. And the healthcare side, the Johns Hopkins map of COVID cases and the infection rates and death tolls, and the immediate politicization and discussions around mask, no mask, and shutdown. And all of this was taking the oxygen on every other aspect of the healthcare crisis. And then on the economy, obviously the surge in unemployment, the various programs from the government to account for the needs of the unemployed, and the lockdown. What was lost was the somewhat incredible and I think unprecedented since World War II public-private sector collaboration that was being led by the tech sector to actually address various facets of the pandemic, both the healthcare facet and the economic collateral damage associated with the pandemic. Really, since the Manhattan Project, there hasn't been this scale of collaboration. And I think, if you're going to take anything away from our report and my presentation, it's the notion of collaboration that was being driven by really genuine concerns for public safety and public health, and not by profit. One example of this that we point to in our report is the IBM High Performance Computing Consortium. Now, while IBM was one of the lead partners in this is grown to reflect a diverse range of players and undertakings, but really amassing capacity, erudition, knowledge, skills, all with a singular purpose of eradicating coronavirus. Some examples of some early successes were crowdsourcing of drug designs based on 80 molecules that participating scientists were able to identify that could potentially counter the coronavirus. Similarly, work that they did with the NASA Ames Research Center on RNA sequencing to identify biomarkers in gene sequences associated with severe cases of coronavirus. This is really in the weeds collaboration, and when there is a solution, when there is a monoclonal antibody or a vaccine or therapeutic treatments that arise, it will be the product of this effort, almost certainly. Similarly, we could point to another example of immediate collaboration between two entities that are fierce competitors in the market, Google and Apple and their privacy-preserving contact tracing. Their exposure notification network are tools that basically have handsets sending random codes every 10 or 20 minutes that involve basically voluntary participation by the handset owners. It's an open question as to whether or not the participation rates would be so high without the commitment of both firms to privacy preservation measures. Most notably, the fact that if you test positive, your identity won't be amassed in a database of people who've tested positive, but instead your identity will be kept anonymous. This not only respects privacy, but it enhances the efficacy of the solution. But as important as the privacy preserving measures was the fact that it's Apple and Google. And here we've got a majority of individuals in the United States either own an iPhone or a phone that has the Android operating system. So but for that collaboration, this very powerful tool would not have been possible. And again, this sort of harkens to this theme of collaboration that's been an immediate response from the COVID crisis. Other examples, I mean, simple things we're taking for granted. The platform that we're using today, the fact that we're using lingo that didn't exist pre-COVID. We're spending time in Zoomiverse. We're relying on Amazon as our supply chain. These things that we just take for granted that we didn't put much value on pre-crisis that have become cornerstones of our quotidian existence. Typing COVID-19 into Google, for example, produces a dashboard with an overview and statistics information that's helpful on testing. Typing in COVID-19 testing in Google, or symptoms rather, brings up an interactive Google COVID-19 tool for self-assessment. All of these are tools that have arisen not driven by profit, not driven by any ulterior motives other than a commitment to using tech for public safety. The community mobility reports that Google has put forward have also been incredibly important assets for research on program efficacy as we struggle to find solutions with how we can relaunch the economy, how we can return to work safely, how we can congregate without increasing risk and driving numbers for a second wave. I would also put forward that in the economy, the application of tech has been profound. One example, we were privileged to interface with Cabbage, which they were the first to actually automate the application process for PPP loans. And this small tech company quickly became the second largest PPP lender in the nation. And you recall a lot of the media around these loans were that the traditional lenders were processing slowly and manually and were only extending credit to existing customers. Cabbage broke through that barrier, they smashed through it. They extended and they focused primarily on lower income, minority borrowers. If you look at 50% of their loans were under $13,000 and 92% were under $50,000. 1/3 of their loans were to households in zip codes with an average income of below $50,000. So these, when you think of them individually, they may not seem significant, but when taken together, these are powerful tools that have helped mitigate the harms that many people have experienced either in the healthcare arena or in the economy, and are really making a difference as we continue to push forward and deal with the new. So Jordan, thank you for the opportunity to present, and I look forward to the discussion.
Michael, thank you. I think that was a great overview, and it really shows the value of what companies are doing in the tech space with data. But now I want to hear from the folks from the companies that are actually doing it. So I'm going to throw open the question to our three other panelists. How specifically are your companies using data to address the COVID-19 pandemic directly? And I'll start with, we'll go with Krista first.
All right, so thanks. You might wonder, why is a weather company on this panel today, right? But we've done our own research. There's a lot of papers published that actually suggest it's common for the general population to perceive a correlation between weather conditions and their risk of illness or symptoms, whether that medical correlation exists or not. Given this association, we have long offered features in our apps and websites specific to seasonal allergies, flu risk, breathing, and our users rely on those regularly. Because of our foothold in both this weather space and this health space, in combination with our reach and our daily habit, we felt it was our obligation to provide our users with COVID-19 information, free, reliable, accurate, timely, that really details the spread of COVID-19 in counties and cities and states and countries around the world. We did this by using publicly available data sets from state, county, and country level websites around the world. We used AI on top of that data, and then we used our web and our app platforms in order to carry forth that mission. The hub that we launched in March details infection rates, death rates, 7-day trends, resources for treatment and help, and many other things. But it's been used by tens of millions of people around the world. And they refer to that when they're making decisions about the health of themselves and their loved ones. So for us, the choice to offer this was critical. And we did it because we knew, given our reach, we could play an extremely important role in helping manage the spread of this illness.
Thank you. Sushma?
Thanks, Jordan. I can think of a couple of different examples. One is specific to many of the customers that we work with who are also looking at the impact of COVID on various patient populations. One of them is a very large cancer center in the US that's been looking in cancer patients who who are at higher risk. And the important thing for them is to be able to integrate data across multiple sources, but then also to be able to collaborate with their network partners. And that's been a significant effort that we've been able to help them with, both pulling public data sources as well as some of the patient-specific data from their own patient populations. Our parent company, as I mentioned, is very active in healthcare, and EMD Millipore is one of the largest providers of critical raw materials, both for therapeutic development and vaccine development. And so, to echo Michael's theme of collaboration, that's also an area we've been interfacing with a number of their customers to ensure that the supply chain can be managed to support the ongoing efforts. And lastly, I'd like to share something that's probably more of an internal example. We're very committed to making sure that we look out for the safety of our employees as well as customers. And with essential business functions who have to travel, there's just a wealth of information out there, but sometimes it's hard to sort through. So one of the tools that we created internally is actually pulling from many public sources to create a travel dashboard that can help any employee who needs to travel to understand, so what is the risk level of the location that you're planning to travel to? What are the entry requirements in that state? And also when you return home, what are the applicable requirements and quarantine regulations? So it's all in one place that can allow for more transparent and timely decision making.
No, fascinating. I myself, as somebody who's traveled a little bit, I find tools like that incredibly useful during this pandemic. So thank you. Andy.
Yeah, thanks, Jordan. So I guess, first I just mentioned with regard to the example that Michael was referring to with Google and Apple's collaborative development of an exposure notification feature and API, that Google and Apple are actually both members of AdvaMed, and it's really just indicative of the fact that our Center for Digital Health represents not just traditional medtech and emerging medtech, but also converging technology that's coming into the medical device space, medical technology arena, and kind of this overlap and development of a new digital health ecosystem that goes, way beyond what medical technology used to look like. But to drill down on your question a little further, of course, AdvaMed's member companies have been supporting the front lines of the pandemic fight from the very beginning in myriad ways by developing, for example, and manufacturing and shipping so far over 200 million diagnostic tests, supplying ventilators, PPE, and other critical medical equipment, and working directly with healthcare system clients to monitor and track COVID admissions, treatment, patient outcomes. And our diagnostic manufacturers, for example, don't just ship out tests. Their diagnostic platforms are a critical component of our national testing infrastructure and supply continuous test data that inform state and federal pandemic tracking and response. Within health systems, our companies that administer patient management systems have real-time insights into COVID case numbers and patient care. That's also informing both frontline workers' response to individual patients and case management, but helps inform policymakers as well. And then, of course, in the wearables arena, there's been a lot of work on developing algorithms for symptom identification, early detection of infections. And then we've seen what might be viewed as kind of basic, very simple technologies in terms of temperature monitoring and so forth. But we've also seen the addition of data capabilities in things like temperature monitors and so forth to collect and manage data, for example, across workforces. So our companies really have been active in utilizing data across many fronts of the pandemic response.
So we've talked about the benefits of data. What are some of the technical and the regulatory barriers to fully utilizing data for public health purposes? And for example, what are the incentives for companies in the public sector to collaborate?
Well, Jordan, maybe I'll jump in there on one barrier that we spent some time working on, and we're glad to see the administration address to some extent, and that was the ability of companies to share information relevant to pandemic response that where sharing was prohibited or, let's say, restricted under HIPAA, for example. And so we saw the administration respond by issuing some notices of both waivers and in particular notices of enforcement discretion to allow covered entities, for example, under HIPAA, to share data that otherwise wouldn't be shareable given those HIPAA restrictions. And so I think that's an area where, even though the administration was able to see some regulatory measures to address it, probably deserves some more policy discussion around how data that otherwise is appropriately subject to sharing restrictions should still be liberated, in a sense, if you will, for responding to a public health threat like this, and still maintain privacy, of course. And then we had seen some additional challenges that the administration had issued that notice of enforcement discretion with regard to covered entities, but hadn't extended that to business associates. Many of our companies are sometimes both the covered entities, but particularly our business associates. And so, the complications of HIPAA sharing rules can sometimes get in the way of responding quickly in public health situations like this.
Yeah, I'd be happy to build on what Andy shared. I'd say I definitely echo the fact that many of the customers that we work with are covered entities under HIPAA, but they're also sometimes operating across state borders. So not just the HIPAA laws, but also other applicable privacy laws are things that they have to sort of find their way to be compliant with. So having some of the newer guidance coming out, and I think this ties very much into the question around a national data strategy. In healthcare, of course, something that Michael highlighted is there is that data for good principle that applies. So there is an inherent incentive to collaborate, but I think it's some of the technical barriers around just dealing with disparate data sources, some that are public, some that are internal, and they're often not quite interoperable, as well as being able to find an environment that really enables collaboration as it comes to compliance with various laws. I think those are the things that we hear as frequent themes from many of our customers.
Yeah, I think my point of view on it is I champion everything you guys have to say, but we come at it from a slightly different angle as well, which is that we develop on top of just regular internet protocols and regular operating systems that are put into market. What we typically do is not in our own environments or our own walled gardens. In private sector companies like us, we encounter roadblocks when it comes to compliance and responsible innovation. A lot of the regulations are not written with a deep expertise or understanding of this technology that we use. It doesn't understand the limitations of the technology or the capabilities of technology. And I'd almost challenge that regardless of the industry you're in or the technology you're developing on top of, a lot of the regulations actually fail to acknowledge the reason why businesses actually collect data. And that I think actually puts burdensome constraints on public companies and actually hampers innovation. And so I think there are a lot of great collaboration opportunities continue to face us, and the Google and Apple example that you guys have given is one of those amazing examples of collaboration. But I think we have to go back to some of these roadblocks, and we really have to be honest about how we're going to address them at the national level.
So we got into the issue of privacy. There's been a lot of debate about what should go in a national privacy law. The chamber itself put forward its own model privacy legislation about two years ago. We heard a lot from Representatives Del Bene and also FTC Commissioner Phillips. Bipartisan agreement, we need to see something done. I think I'll toss this out to everyone on the panel. What should we see in national privacy legislation?
Well, Jordan, maybe I'll jump in there. It's kind of an easy gimme if I go first, I guess, on a couple of key principles. And, we certainly endorse some of the, really important principles that the Chamber has outlined as well for, national approach to privacy. And certainly, in our view, they include a consistent set of national regulations, right, to avoid the already emerging scenario in which we have many different requirements across various states. And I should really say, first of all, we're all in on privacy protections, right? We have no objection to appropriate privacy protections across the board for patients, for consumers in general. But if there aren't a set of rules of the road that are consistent and equally applicable across at least the US, let's not get into global harmonization, but at least across the US, then it will make it extremely difficult both to, even just to implement those requirements, but also to provide, the services and benefits that consumers and patients in the healthcare system have come to expect from our data capabilities. So having that consistent set of kind of one uniform set of standards and expectations is really critical. And we can certainly talk more about some other aspects like private built rights of action and so forth. But that consistent set is really a starting point.
Yeah, I agree. I think you also have to have the reasonable rights baked into that framework that allow for innovation. And I think one of you had already raised that sort of that framework that allows us to innovate quickly, in the face of crisis or those types of things. So that those rights baked in, as long as data is properly disclosed and an opt-out is allowed. I think there have to be agreed upon methods for de-identification. There really needs to be an open dialogue as well, as this national law, hopefully, which we'll get one day, starts to come through. You have to have regulatory agencies willing to talk about what compliance looks like, because today it's put on paper and it's tossed over the fence, and there's not that back and forth conversation. I think that'll be really key as we look to a national strategy.
Yep. I would agree with everything that's been said, and I'd add to that as well that the harmonization that both Andy and Krista spoke to is going to be really important, and additionally that it's actually also something that creates an environment that incentivizes collaboration. So to make sure that the reporting and compliance requirements aren't too onerous, so they're actually more fostering collaboration, I think that's going to be important. I'd also say that having input, looking at both a public-private partnership, because Krista also spoke to the point that sometimes the laws don't actually encourage innovation or allow companies to collaborate. So that's something that's important. And Andy, I agree with you completely that the starting point is to have something that's applicable to the US, but ourselves at EMD Digital, our parent company, and many of our customers are multinationals. So we're already having to navigate through things like GDPR and changing European laws. So that international harmonization is also going to be important.
Yeah, Jordan, I might also just add on that. We think a lot about the extent to which it's feasible or important to address different categories of data. And we think about that, of course, from a healthcare perspective, and having HIPAA on the books, essentially regulating a subset of health data out there. And our general concern around the enactment of a national privacy set of standards, or let's say a national privacy bill legislation, is that it may not adequately address the complexities and unique nature of healthcare data. Obviously, other industry segments may feel as well from their standpoint that they have special concerns that might not be adequately addressed either. But we certainly think about that a lot from the healthcare perspective. And so we're working on continued policy development in that area. And I think, it's going to be critical for us to continue to talk to policymakers about healthcare data as a certain special set of data within the broad arena.
Thanks, Andy. Michael, do you have something to say?
Yeah, I was just going to suggest really less around the specifics of the details, but more on principles that oftentimes privacy is approached in reaction to some phenomena, the data breach, or even a legislator's data had been hacked. And it's important that the value of the data is taken into consideration, that what comes forward is proportionate and not overly restrictive, so that we don't risk damaging the tech sector and the ability of the sector and all of the industry segments that rely on tech to use data in innovative ways and continue to grow the economy. So it really has to be a proportionate and deliberative approach. And then also I'd suggest that it needs to be flexible. I mean, frequently by the time a regulation comes into effect, it's oftentimes already outmoded and outdated by the march of technology. And here we're talking about the lifeblood of the tech sector, and it's the most dynamic sector, probably in the most dynamic period in history. And so there needs to be built in a high degree of flexibility to account for inevitable technological change.
Andy,
yeah, if I could just build briefly on what Michael just said, because we obviously agree completely about the risk of overly constraining innovation, right? Which of course is for the benefit of consumers and in our case, patients. And I come back, I think, to a general notion that, privacy doesn't mean not sharing, I think, just as a conceptual standpoint, right? It means sharing in consistent with expectations from the person, that gave the data, right? So it's all about transparency and trust, and making sure that, when folks give their data in the first place, they understand how it's going to be used, right? And that might be data used widely in various contexts. So it's really, I think, that one of those, the concept of privacy is less about, keeping data, in one place and for one narrow purpose, but more about making sure that, the original donor of data understood how it was going to be used and their expectations are, obliged and understood upfront.
I completely agree.
Ada, you brought up a point about enforcement. Who should enforce a national privacy framework?
Well, we haven't taken a very detailed position on this, but we have in various comments on current, federal legislative proposals suggested that we don't think a new privacy agency is necessarily the answer there. I think we probably would lean towards saying that the Federal Trade Commission, with the right resources and some expanded responsibilities, is the right place, the right enforcer generally. Right now, obviously, HIPAA is overseen by the Office of Civil Rights at HHS, and so we certainly would endorse continued oversight there from a HIPAA perspective. And HIPAA, of course, might be modified, expanded in some way. But as a general matter, I think we would generally favor the FTC continuing to be the overall arbiter of privacy regulation.
So, I think, Jordan, your question was more on a national level, but I think it's also important to recognize that when you look at players in the healthcare field, certainly, academic medical institutions, a lot of them also have internal governance and enforcement as it comes to patient data. So there's already a system that exists of, institutional review boards, data governance boards, and so on. And so I think that's also an important aspect that exists and, will continue to play a role as we look at privacy and similar requirements around data.
Now, Sushma, I think you bring up a good point about enabling some degree of self-governance. I think that's also a very excellent point to be made about how we look at a national privacy framework. In terms of, if you look at our proposal, for example, we think the appropriate agency generally, and when you look at a few sectorally specific issues, some exceptions there, but for the most part, we also believe the FTC should be the lead agency without having to create a new privacy agency nationally, and also having a role for state AGs. At the same time, creating certainty without having multiple attorneys general or millions of them potentially through private rights of action. But at the same time, I think you bring home the good point is that we do need to have some degree of safe harbor and certification and protection, so that companies that are really acting in good faith and are self-governing well have the incentive to do so and collaborate with government. I want to switch gears a little bit and talk about AI, and maybe Krista and Sushma, we could talk to this a little bit. What are the benefits, and can you speak to the role of how AI is going to play in the solutions that you all are developing?
Sure. Yeah, absolutely. We have actually a lot of examples of how we use AI. We established the fact that weather truly is at its core the modeling of atmospheric patterns, and it just becomes natural to understand that data and AI is really part of that process. We actually use AI in a lot of things, but just to give you maybe two examples, I think, that are pertinent to how we do it in weather. AI is at the heart of our proprietary weather model that we call GRAPH, which stands for Global High Resolution Atmospheric Forecasting System. It's a mouthful. But this model actually predicts weather up to 12 hours in advance at a resolution and a detail level that we've never seen in the world before. No one else has been able to achieve this yet, and it's through AI that we got there. And what's even more interesting about that is that this model performs in areas of the world that previously didn't even have moderate quality weather data at their disposal. So that's pretty interesting when you think about the amount of data we put together to actually produce that. But then AI played a role as well in our health endeavors. We use AI to actually correlate various aggregate claim information so that we can understand under what weather conditions and in what region. We may see increase in flu cases, or we may see increase in allergy symptoms. And we can look at that through, purchase data, for cough drops or cold medicine and allergy medicine to all sorts of different data sets. So we use it in that sense as well. When we find those correlations, we're actually able to predict out to 15 days your risk of symptoms or your risk of illness and those types of things. So we use it, quite extensively.
Thanks, Krista. I think my examples will be more on the healthcare side, and there's a couple of interesting things. One, obviously, is as you all know, one of the key success factors in AI is actually having the appropriate data set to train your algorithms to begin with. So we've actually been working, I guess, to use AI to actually help us identify the quality and completeness of data sets that are coming from various healthcare sources. One of the things that we're actually working on with one of our academic medical partners right now is, with the ongoing COVID pandemic and now heading into flu season, one of the questions that they're certainly looking at is what happens when you have the confluence of those two viruses and how is it going to impact specific patient populations. So we're working with them to refine some of the algorithms that they had built. I also mentioned, some of the travel tools that we've created internally. They also use AI to be able to pull real-time data from various data sources and to stay up to date with changing guidelines in various places. So I'd say a lot of what we're doing with AI is really to say, how do we streamline some of these routine data collection and data analysis? So certainly as it comes to healthcare, we can free up human intelligence where it's needed. Because in some areas that we work in, for example, rare diseases, just the fact that the data doesn't exist actually hampers our AI efforts. And so we're trying to make sure that where we can, we streamline activities so our healthcare providers can actually focus on applying human intelligence where it's needed.
Jordan, if I could maybe elaborate just quickly on Sushma's comments there. For us, AI is critical. It's a crucial tool, and there are many examples of AI being deployed already in medical technology and healthcare. But there's two issues I would call out, and one is on the R&D side, which is Sushma was just saying, data and rich data are critical to the development of AI, and there's a rich arena of data. It's in the HIPAA universe. That can't necessarily be liberated for AI purposes because just for R&D is not necessarily a purpose contemplated under HIPAA. And so there are certain constraints right now in our current regulatory system that are limiting, if you will, the advancement of AI that certainly could be done and still be protective of privacy. But then the other side of the AI coin from a kind of a regulatory standpoint is FDA approval. And not so much with fixed algorithms or so-called locked algorithms where you have a piece of software and it's got known inputs and outputs that result from those inputs, right? And you go to FDA and you get cleared or approved for market use. The question comes more to machine learning systems, unlocked algorithms that are continuously iterating based on being in the wild and aggregating more data as they operate. That's a to figure out how to regulate unlocked algorithms in the context of their current regulatory system. They put out some good kind of white paper thinking on that. Might require some statutory modifications to get us to that future. But I would just note that that's really an area of great promise, but still some regulatory uncertainty.
That's a good point about HIPAA as well too, Andy. I think all of those examples are just fascinating to hear about what you all are doing, Sushma and Krista and Andy, and your businesses. Dr. Turner, but we actually released a report as well prior to COVID-19 and about the month before it struck, and I fear that we didn't quite get it out as much as we wanted due to the pandemic breaking, but it's an excellent report and you can find it at americaninnovators.com. But it's called Data for Good, Promoting Health, Safety, and Inclusion. With a lot of issues about equality of opportunity in the news and as we're looking at the election, can you tell us about how data is being used to enhance equality of opportunity?
Absolutely, and I really am remiss that events overshadowed the release of that paper, but the conclusions and the findings are no less germane today than they were pre-COVID. There are just a wealth of examples in that report, and we were privileged to work with a wide variety of CTAC members and hearing their stories and really drilling down on some of the details and providing data points. Let me just begin with financial inclusion, simply because that's the issue area upon which I have the most experience. Here we looked at Experian Boost. It's something probably, if you're familiar with it, you know, because of the commercial with John Cena and the purple cow. But effectively what they do is they allow an individual to permit access to non-financial payment data, what we call alternative data, to have that scored in a proprietary credit risk score, and to boost their credit score. That could be by as few as by as little as a few points. It could be 10, 15, 20 points. But if you're on a decision point, if you're between tiers and your score is instantly boost sufficiently to move you into a better risk tier, that actually could have profound impacts in terms of accept, reject, and the terms and conditions you receive. And clearly here we're talking about wanting to increase access to affordable sources of mainstream credit so individuals can get loans to buy homes or to start a small business, which are the two primary means by which people in this country and everywhere build assets and therefore wealth. Beyond that, there's another example we cited where LexisNexis partnered with Connecta Federal Credit Union, and they were able to help individuals consolidate high-cost loans, possibly from fringe financial institutions, into a single lower-cost loan. But these are individuals who don't have a traditional credit report, and using their risk view solution, they were able to score more than 80% of those persons and help them greatly reduce their debt service burden. And again, that helps people compete and helps them pursue economic opportunities. Similarly, and again, with a constraint on time, there are other examples in there from Square and MasterCard and other CTEC members. I would encourage you to go and find. In terms of public safety, there were some rich examples there as well. I wanted to give a tip of the hat to Krista, since she's from the Weather Channel, and Weather Splunk, one of your members, Jordan, had partnered with a firm called Zonehaven, where they were pooling together rich data assets from weather stations with field sensors and other early warning devices to detect fires and help direct efforts at combating them. And this is something, obviously, given the events of the summer, is quite critical in our ability to mitigate and control harms that result from these fires. I mean, people have suffered tremendously in all across the country this year. Thomson Reuters, one of my favorite stories from this, again, not in the economic opportunities, but in public safety. Their solution, Clear, was used by law enforcement in the wake of the immediate wake of the San Bernardino, California Terrorist Act, where they were able to provide information that would have been unavailable to law enforcement to help them apprehend the terrorists while they were rearming to go commit further acts of terror. So that the whole notion of this data, these core data assets that are used for economic development, that are used for core business functions, but they produce a range of tertiary or ancillary applications that wouldn't be possible but for the permissive use of this data for those core business functions, have these social and economic benefits. So this is what we urge lawmakers to take into consideration when they're looking at national privacy legislation. It's not just the big picture metrics, the GDP and productivity. I mean, just as an aside, I suggest that it took decades for government economists to understand the impact of computers on productivity. And they cracked that nut. And now you've got teams of economists in government agencies who are trying to understand specific data values, and they're continually refining GDP numbers, productivity numbers, because they're seeing how profoundly data is impacting these metrics. And those are just the sort of the high level. They're not accounting for the types of examples that we're discussing in our study. And we just urge lawmakers, as they look toward national privacy legislation, not to discount these simply because they can't be measured.
Thanks, Michael. I'll go ahead and open up things to Q&A. If you've got a question, I encourage you to type that in the chat now if you have one. And that's quite all right if we don't get any. I think you've all explained pretty well what you all do. Before we leave today, I wanted just to give everyone a chance just to provide any closing remarks or any key takeaways you'd like our guests to learn from you all today. So, Sushma, I'll start with you.
Jordan, once again, thank you very much for being part of the panel, to also have the chance to hear the perspectives. I think I would echo again that, representing the views of many of the researchers and medical institutions, as well as healthcare customers that we work with, that having a harmonized national data strategy that really enables collaboration is something that we're all rooting for. I will also say that many companies, including ourselves, are also making sure that we play to the self-governance aspect of it. One thing I can share is, for ourselves, we actually have a digital ethics board that we've created that includes just experts outside of the company to provide guidance on many of these issues and to also come up with a digital code of conduct. So we're very much looking forward to seeing the output from the chamber as well as it moves forward. So thank you, Jordan, and thank you also to my fellow panelists, because I always learn a lot by interacting with people in this area.
Thank you. Chris?
Great, and thank you, Sushma. I would say the same for you as well. I think my final statements would be that I'm optimistic that we can continue this conversation, in our own environments and on the national stage. To your point, Sushma, we actually learn a lot from each other, right? We have our own internal governance policies as well, but continuing to learn how other companies are doing that, doing it well, is really important, I think, for all of us to responsibly use data. I think, Ben, the other thing I would say is, Michael said it, we all understand inherently right now that data's impact is really hard to measure still. We talked about a lot of examples today that are extremely important to the development of innovation and things that have really benefited the public sector, but it's still really hard to measure. So I'm hopeful, I'm optimistic again that in the future we will continue to see data give birth to advancements, that we will see innovation paired with obligation, right, to protect personal data, innovation paired with individuals to make decisions on how their data is used. And I think that if we can do that in our own practices as each one of our companies, and on the national stage, I think that we as mankind will all win.
Thanks, Krista. Andy?
Yeah, thank you, Jordan. And I also echo the thanks for the panelists here. I really enjoyed the discussion. I think, I'd come back to saying that while, next steps on national policy must be guided by privacy, they must also be equally guided by the value of data. Coming back to the topic we were all discussing a little bit earlier. And, we've seen tremendous increase in the value of data over the last, couple of decades, powered by the technologies that we've been talking about. But I think, we're still only starting to uncover what data can drive in terms of value across the economy generally, for consumers generally, and from our perspective in healthcare. And so I think, we have to be equally guided by the prospective value of data as we figure out how to craft privacy policy that works in the future for industry as well as consumers.
And Dr. Turner, I'll give you the last word from the panel.
You might come to regret that. Let me suggest I would exhort lawmakers and regulators to continue to look to the future, to embrace data and not to look at it as something to be feared, to be proactive and not reactive. And let me give you an example in COVID. There is increasing talk about having data depression or suppression and deletion around payment data, in the notion that we have an economic recession, people are out of work through no fault of their own. It's unfair to punish them for circumstances beyond their control. So let's just suppress all data. It's this crude, data is something to be feared, let's suppress it. The problem with this is it could be very disruptive to the entire financial sector and therefore the rest of the economy, because lenders will be unable to differentiate between good and bad, and therefore we'll have a credit crunch. So at the same time, when federal and state lawmakers are trying to grow the economy out of a recession, they're going to run into the mother of all headwinds in the forms of a credit crunch because lenders simply can't make decisions. Rather than being against data, embrace data as the solution and not the problem. Advocate including other types of predictive data, non-financial payment data. People pay their mobile phone bills, cable TV, broadband, satellite TV, rent, all sorts of things that aren't currently in the system that, if included, would dramatically increase access to affordable financial services and would empower lenders with data to make better decisions and would put a tailwind behind efforts to grow the economy. So, we really encourage and exhort lawmakers to embrace the use of data and frame any sort of national approaches with that mindset.
Thank you, Michael. I'd like to once again thank our panelists for enlightening us today on the value of data and the great work that their companies are doing to improve our lives. I'd also further encourage you to take a look at americaninnovators.com/tech upgrade to take a look at the Chamber's National Data Strategy calling for national privacy legislation, a robust AI framework, and IT modernization at the federal, state, and local level. And finally, I'd ask you to look at some of the other white papers on the workforce of the future, how to connect all Americans, and transportation of the future. So once again, thank you very much and have a great rest of your day.
Thank you, Jordan.
Thank you, Jordan. Thank you, everyone.
Thank you, Jordan. Bye.
Yeah.